The holidays are coming. Christmas is near and Thanksgiving just passed. Even in this pandemic, the joyous spirit is still alive and we can still feel it. We want to celebrate the season with our loved ones either by eating together or giving each other gifts. What if we fast forwarded time to Christmas Eve? Suppose you would be eating that scrumptious food you have been waiting for all year long. The next day after the delicious Christmas Eve dinner you just ate, you wake up just to find out that you can't smell nor taste anything. That wouldn't be funny, would it? Well, at least you would be able to eat your vegetables this time. Kidding aside, we wouldn't want to lose our sense of smell nor our sense of taste. If we don't want that to happen to us, we must realize that we are all affected by the pandemic. Anybody can lose their sense of smell and their sense of taste. COVID affects us all. It can be the old, it can be the young, it can be men, it can be women, and it can also affect us in different places all over the world. Right now, there are more than 400,000 confirmed COVID cases in the Philippines. Because of many factors like celebrating together, the spread of the virus has been more rapid than ever. In studying the spread of COVID-19, demographics have come into play. Demography plays a huge role in assessing the situation of the Filipino population during this pandemic. Age, sex, and regional background are important demographics to consider in evaluating the spread of the COVID-19 virus. We are looking for trends and patterns of this pandemic. Are some people more affected than others? Who are more likely to be infected? Demography may provide answers to these questions. According to the World Health Organization, out of the total confirmed cases reported in the Philippines, 55% are male with the most affected age group 20 to 29 years old, followed by 30 to 39 years old. This means that 45% of the cases are women. These statistics show that men are more prone to catching the virus than women. In fact, the Centers for Disease Control and Prevention in the United States have found that male deaths from COVID-19 are higher than female deaths due to various factors that put men at a significantly higher risk. Aside from gender demographics, regional statistics also play a key part in looking for trends and patterns of this pandemic. According to the Department of Health website, the National Capital Region, or the NCR, has the greatest number of confirmed COVID cases in the Philippines, with more than 200,000 people. The NCR has a population of 12,877,253 according to the 2015 National Census. Because of high population density in this region, COVID cases are more likely to spread among the populace. In fact, Metro Manila was one of the first places to be put in lockdown. Yet this did not deter the spread of the virus. From the significantly higher number of COVID cases in megacities like Metro Manila, we see a trend where the virus is more likely to spread in densely populated areas. Age demographics are also important in studying the pandemic. Out of more than 8,000 confirmed COVID-19 related deaths in the Philippines, 61% are male, with the most affected age group aged over 70 years old, followed by those belonging to the 60 to 69-year-old category. The most affected age group are the people aged 60 and above, which are senior citizens. Based on these statistics, older people are more at risk from dying from COVID-19 infections. Underlying medical conditions can also increase the elderly's risk for contracting COVID-19. Demographics are significant. They can be used to find a pattern or a trend in COVID-19 infections, which may help us in analyzing and creating a better response to the pandemic. As we have seen, there are many types of people affected by the virus. Age, gender, and regional statistics are important factors in learning more about how this disease spreads. In the meantime, while we are uncertain of how to curb the infections, ordinary citizens like us should do our part in reducing the number of outbreaks. Do you want to lose your sense of smell and sense of taste too? Is it better to spend Christmas by yourself at the hospital away from your family? If we don't want these things to happen, we should follow strict guidelines and practice basic hygiene like frequent hand washing, staying at home, wearing masks and face shields, and social distancing. These actions are among the many ways we can contribute to flattening the curve, so we can hopefully spend time with friends and family at a much earlier date. That is all. Thank you.